Welcome. We will start at about 4:02. Hello and welcome. My name is Melissa Long, and I'm the Director of Education and Support at Insight Memory Care Center. And today we're going to be talking about Medicare 2025. Are we ready for the new rules? Our guest speaker is Kevin Chaikin, and he is a licensed insurance agent with Medicare Portal. He answers the top 5 frequent questions asked by Medicare beneficiaries. He'll discuss the basics of Medicare and identify your key milestones and decision points that are critical to get the most out of your Medicare and supplemental insurance. We are recording this. You will be able to see this later. And at Insight, our mission is to provide specialized care, support, and education for individuals in all stages of memory or cognitive impairment, their partners, and the community. Our vision, a community where those living with memory or cognitive impairment and their care partners can achieve the highest quality of life. We're a leader in dementia care in Northern Virginia. Insight is a nonprofit started in 1984 that supports families on their dementia journey. We have our 40th anniversary this year, and we're very excited to celebrate that. We use care with specialized adult day programs for people in all stages, from early stage all the way to end stage and hospice. Our connection is building relationships and supporting care partners on their journey. And with creativity, our dementia experts share their knowledge and resources because every journey is unique. I'm going to go ahead and have Kevin present first. We'll do a Q&A afterwards. Please feel free to put your questions in the Q&A box, and I will read them out to him at the end, and we'll get all your questions answered. We'll also be providing a copy of his PowerPoint as well when we get this up online. So Kevin, welcome, and thank you for being here.
Yeah, thank you so much, Melissa. I appreciate it, and I'm glad to be here today. You guys hopefully can see all this and hear me good, hear me well. Wouldn't mind just confirming.
Yep, we're hearing you good.
All right, awesome. Well, thanks again for having me. As Melissa mentioned already, my name is Kevin Chaikin. I'm with MP Group. We're a Medicare insurance agency. We focus exclusively on Medicare. And for those of you that may be returning from last year, thank you for coming back. We did this in October last year, and this is a little bit earlier, but in our minds, September really is the start of annual enrollment because of all the information that starts coming at you or your loved ones regarding Medicare this time of year, and it's a good time to start preparing. So let's educate early so that no one's feeling like they've only got a few days or a couple weeks left to make decisions for the following year. So today we'll cover Medicare annual enrollment and what you need to know. And we'll take some questions at the end, of course, and there's some contact information down there if you have any questions afterward. We'll put this up at the end as well. So let's just start with a little, I think it's humorous, but it's a little scary as well. But what you're told during Medicare annual enrollment period. So you are typically hearing things like, now's the time to make a change and you have to do something. You also hear that you qualify for plans that cost nothing and pay back your Part B premium. You may also hear things like you can get thousands of dollars worth of free medical supplies and groceries. Now, not that any of that is not true in some respect, but typically it's a little bit overstated. Those are the types of things you hear from people like Joe Namath and all our pals on TV with these nonstop commercials that hit you from October to December. Now, the reality is really two things that everyone on Medicare should know during annual enrollment is that number one, you don't have to make a plan change during annual enrollment. The majority of people will not make a change and do not need to. It doesn't mean that's you individually, but that's not a requirement. It's also not a requirement to renew coverage. That typically happens automatically. And number two, if it sounds too good to be true, it probably is. It's obviously an old adage there, but it certainly goes with the Medicare claims as well. So two things to keep in mind. That's the reality of Medicare, and those last two things are what we're here to tell you, your Medicare partners here at MP Group. So just real quick, and then we'll hop into the content. We are in the Tyson's Corner, Northern Virginia area, although we are pretty much nationwide in terms of the footprint that we service. But we're an independent Medicare insurance agency. We provide no-cost education, enrollment, and lifetime support to Medicare beneficiaries, starting with education about Medicare 101, A, B, C, D, and enrolling in what coverage you need and servicing those policies. We're all paid by the insurance companies that our clients choose to do business with. As I mentioned, we're independent, so there's no fee for the service, or we're not working for an individual insurance company. This is our current footprint. I know we're obviously in more of a targeted geography here in Virginia, but maybe you have a family member that moves or need elsewhere. We're certainly able to help across most of the country, and that those states are filling in every week. So just one more thing, just to tell you more about what I am looking to do to help people when it comes to Medicare. I got into this in 2019 after really seeing it front row. I was not, of course, not in this industry before. It wasn't in insurance or anything. And my father was going through Medicare enrollment for the first time and totally just made mistakes that we coached people out of, ran into late enrollment penalties and lapse of coverage and all sorts of things, just because it's hard to understand. We hear that all the time, every day, every week. It's like, you think that you feel like you're educated, and you are, and you're intelligent, but it's hard to wrap your head around. So that's what really got me into this, and been helping Medicare beneficiaries ever since, having over 1,000 clients in the agency, and talking to thousands of people a year to just make sure that educational piece of Medicare is understood before taking any further steps. So that's my family on the left, 2 boys and a girl, and that's who I wake up for every day to do this for, and obviously for our clients here as we build the agency.
And
So,
Kevin, I do want to say he does reach out. He helped my mom, and she's up in New England, so he is wonderful helping people, even if you're not in our Virginia area and you're one of our family members that is out in other states. So do reach out to him.
thank you, Melissa. Appreciate that. So here's what we're going to cover today. So enough about me and MP Group. We are going to talk about some important content. So let's cover the basics, which are parts of Medicare. Let's just make sure we are all level set on the alphabet soup of Medicare. Let's talk about what is annual enrollment, who's eligible, so who is being impacted by this right now, what can change in your benefits, where can you find those changes, what changes can you make, some upcoming changes for us should be 2025, excuse us, but 2025, and then how we can help. So let's just cover these basics. So we have Medicare A, B, C, and D. These are the parts in the alphabet soup that you hear about all the time. So each one we'll cover here. Part A is your hospital coverage. That's your inpatient care, like hospitalization, rehab, home health, and hospice are included in there. And most people, most of you are not paying anything for Part A. That's been paid through your taxes, just like your Social Security benefits help you qualify for, your work history helps you qualify for your Social Security benefits. So most people pay zero. It can be purchased at a rather high price, but again, most of you are probably, if not all, getting that at no cost at this point. Now, Part B is medical. So that's your outpatient care. That's more of your day-to-day doctors and healthcare providers, preventive services, ER, urgent care, surgeries, physical therapy, OT, ST, et cetera. You name it under Part B. And that is going to cost a premium for most everybody. The base premium this year is $174.70 per month. We don't have information yet on 2025 premiums. That's why we have not put it in there yet, but that'll certainly come out in the next month or two. Of course, you can have impact of income adjustment on that as well. And just to make sure it's understood, parts A and B are the 2 parts of Medicare you get through the government. So typically you start with A and B. Government's going to issue those. Everything else we talk about and help with, parts C, D, and Medigap, they all come through the insurance companies. So Part C, this is one of your choices when you go on to Medicare. Part C is also known as Medicare Advantage. Those are one and the same. So these are all-in-one plans. So your A and B benefits are now included through this Part C plan, and typically Part D, which we'll dive into a little deeper here, but that's your prescription coverage, all wrapped up into one. For just easy remembering of what Part C is, I like to think of the C as standing for combined. It combines all your coverage into one plan. So very similar to what we're all used to having with employer coverage or any individual healthcare. It's a all-in-one plan. And what happens is the government has contracted the Medicare Advantage organization to handle your Medicare. So now that insurance company is primary and only payer on Medicare Parts A and B, and they do have to cover everything that Medicare A and B cover. They may also add additional benefits above and beyond what Medicare covers. So for instance, Medicare does not cover dental, it does not cover glasses, hearing aids, those sorts of things. So those are the types of things you may see added to these types of plans. I already mentioned they're offered by private insurance companies, and they are typical managed care organization designs, HMO, PPO for the most part in this area, POS, a couple other options there. And monthly premiums vary because in your plan options vary based on where you live, and the premiums vary based on what the insurance company wants to charge. Now, many of those plans do have a zero or very low monthly premium. Everyone pays the same amount if you're in the same plan in the same area, male, female, no matter the age. If it's zero, you're all paying zero. In those plans, it will have an out-of-pocket maximum. So whereas Medicare A and B alone do not have any ceiling on your potential spending, Medicare Part C or Advantage will include a max out-of-pocket where, basically what that means is you'll pay co-pays and co-insurance up to that limit. Once you hit that, the plan pays 100%. Part D, so this is your prescription coverage. This is going to be for your self-administered outpatient prescriptions, things you're picking up typically at the pharmacy, also provided by private insurance companies. So, we don't get that through the government. They basically set the rules and the insurance companies provide the coverage. Part D is a hot topic this year. We'll cover a little bit of that later. A lot of changes happening as a result of the Inflation Reduction Act and some other legislation going on. So the plans, as I mentioned, are required to meet certain designs that Medicare has set, but there are a lot of variables. So the premiums vary from plan to plan, and they're all over the place, from $0 to over $100 a month typically. The formulary, which is the drug list, that can vary from plan to plan. All plans have to meet certain formulary requirements, but they're going to have different drugs at different costs from plan to plan. If you're in the high income bracket or you meet a threshold, it goes into a progressive scale. You're in that bracket, you may have an income adjustment and additional premium for Part D, just as you may for Part B. There's also a penalty for not enrolling on time for Part D, just as well as Part B. And this is something you would add typically as a standalone plan. So you would not get a separate Part D plan if you go Medicare Advantage Part C. But if you go with original Medicare A and B, you add a Medicare supplement. This is when you would add a standalone prescription drug plan through a different policy. And then Medigap. So I've mentioned that now a couple of times. First of all, with Medicare Advantage or Medigap, you have to have Parts A and B. So, going back to Medicare Advantage, if you have a $0 premium for Medicare Advantage, that doesn't mean you stop paying the Part B premium. So the $0, while that may be true because the government's paying the insurance company to manage your care, it doesn't mean that you don't have to pay for Part B. In this case, the same thing. Medigap requires A and B to be active because what happens here is Medigap is a secondary payer to Medicare. So without Medicare A and B, there's no primary payer to pay first. You're primary and Medigap's not going to pay anything. So you have A and B, they pay, the government pays first, Medicare supplement or Medigap pays second. That provides additional coverage for A, B, deductibles, copays, and coinsurance. So basically, if Medicare approves it, the Medigap policy pays for it. So it is a way to greatly reduce out-of-pocket exposure and provide a lot more predictability in terms of your out-of-pocket costs. These, again, just like everything else we've discussed, CD and Medigap offered through the private insurance companies. You will pay a premium for these, and this does vary based off things like where you live, age, gender, tobacco use, household size, a lot of variables in there. So there is no, standard premium, but that's something we obviously help with, is to identify what the premiums are for the plans you're looking at in your area. The nice thing about Medigap when you're comparing plans is they are standardized benefits. So Plan G, for example, we're not going to dive into all the Medigap plans here today, but that's the new Cadillac version of Medigap, if you will. And so if you're comparing Plan G from one company to the next, the medical benefits are identical. So access to providers is the same. What they pay for the service is the same. Medicare approves it. Medigap company pays it. Bottom line, that's the end of story. So this is a chart of the Medigap policies. Again, we're not going to dive into each one. Plans G and N are your most popular and most comprehensive. Some of you or some of your family may have qualified for C or F previously. That's based on a birthday. So if you're born before 1955, those plans were available. They are no longer available to new Medicare enrollees, but G and N would be the new C and F. If you want to look at it that way, they are the most comprehensive and popular options that provide you the most predictability and lowest out-of-pocket cost. So as an example, just a case study, we do run into this from time to time during annual enrollment is, someone's been on Plan F, for instance, for, in this case, 5 years, if she's paying $173. Again, that's a totally arbitrary number, depends where you live and a lot of other factors, as we mentioned. But it's determined that maybe she could move to Plan G and save a little bit of money, $40 a month. So she saves $480 a year. Still got to pay the Part B deductible. That's the only difference between G and F. So subtract that out. Carol saves $254 by just moving and not impacting her coverage in any other way other than having to pay the Part B deductible. I bring this up to say, this is not the time of year where Medicare supplement is the priority. If you're on a Medigap plan, your priority is really Part D, prescription coverage, because it's the only time you can change it. But naturally, these conversations come up. And if you go through that process, you do typically have to go through underwriting to make that kind of change. But it is a way that we've helped clients save, in this case, hundreds, in a lot of cases, thousands of dollars a year on their Medigap policy without impacting their access to providers, which is, of course, very important. So let's talk annual enrollment. What is it? It's the set time of year where enrollees can evaluate and change Medicare coverage. So this is for current Medicare enrollees. If you're turning 65 or you're getting ready to retire, you or your family, this is not about when you are supposed to first enroll in Medicare. It's all about Medicare Part C and D, and the changes you can make then. So the timeline is October 15th through December 7th. There are no plans available to discuss until October 1st. So if you reach out to anybody and they're telling you they've got plan information for 2025, or they even discuss it, even if they have the information, that is illegal. We're not allowed to do that. October 1st is the first day that stuff is available for your consumption. And the 15th is the first day you can make a change. December 7th being the last, and the start of new coverage goes into place January 1st. So if you move from one drug plan to another, starts January 1st, one Advantage plan to another, or Advantage to drug coverage, or vice versa. It's all going to go into effect January 1st. So as I mentioned already, this is for folks currently enrolled in Medicare A and B, and they would either have C, which includes D typically, or a standalone Part D plan. So what can change? This is what we really want to make sure you're looking for as we get into annual enrollment. So of course, Medicare A and B, we do see premiums, deductibles, and everything change year to year. We don't have that information yet. It's not going to line up with October 15th. It's typically later in the month or November. So we'll see when CMS releases that information, but those changes do happen. They're not changes that you can impact, of course, or do anything about, because if the premium for Part B goes up, it's going up, right, for everyone. But Medicare Part C and D will have changes to premiums and your benefits, co-payments, and deductibles, your out-of-pocket maximums. So if you have a limit on spending, that can change year to year. Very important to keep an eye on. Your drug list, your drug tiers, so the cost of your medications, and then your plans network. Those things can all change, and those are all things that you can take action on and make sure that you're doing your due diligence and being an advocate for yourself going into 2025. Now, these changes will be outlined. Whether you're in a Part C Medicare Advantage plan or Part D drug plan, you will receive an annual notice of change, which should be coming to you very soon. Usually it's between the 15th and 30th of September. You may get it early. Heard that some people have already been getting them. That's great. The earlier, the better. But that notice will summarize changes in coverage. So your premiums change. A drug you're on is no longer covered. The copay for it's changed. The benefits for dental have changed, whatever it may be, right? So that's what you should be looking for this month. and that's going to outline what's going into effect January 1st. So what can you do or your family member do during this time? Well, if you're on a Medicare Advantage plan, you can go to a new Medicare Advantage plan. Maybe your plan's premium went up quite a bit, or the max out of pocket, which is, of course, your financial exposure, has gone up drastically, and you want to find a plan that's got lower financial exposure, and you can go from one to another. Maybe it's a doctor issue, the doctor's out of network, or a new doctor is needed. You can also go from original Medicare to Medicare Advantage. So if you have just original Medicare A and B, or you have it with a supplement, you can go to Advantage at that time. You can go from Advantage to original Medicare. So if you're on Medicare Advantage, you want to go back to Medicare A and B, maybe you prefer not having a network at all and going to the open access original Medicare policy, then that is an option. Please understand, however, what that does not include is a guaranteed issue opportunity to get into a Medicare supplement plan. In most cases, and this is case by case, we can talk to you individually, but in most cases, you will have to go through medical underwriting to go from an Advantage plan to a supplement. Again, the government on A and B will not reject you for any health reasons. The supplement company can, unless you have some kind of extenuating circumstances, which are very rare. Part D to Part D, number 4, there's probably the most common and most important thing. It's the only time of year you can change prescription drug plan. So, for instance, numbers 1 and 3, you can also do the same thing in the first quarter, January through March. So you have a little bit of flexibility. With number 4, Part D to Part D, it's the only time you can do that. 4, 5, and 6, actually. Any changes to Part D coverage, this is the only enrollment period. So you can enroll for the first time, you can opt out of it if you have some other drug coverage or don't want it. Of course, penalties may apply there, or most commonly, you're changing from one to the next.
Kevin, I have a quick
Yes.
question with that.
Yes.
Is there one exception to that rule is when you're doing lifestyle change? So if someone moves from their home into a care community, they can change their insurance at that time, correct?
Yes, thank you for asking that, Melissa.
Yep.
I'm speaking kind of in terms of general enrollment periods where it's very fixed time, but a special enrollment period, those do go all year, right? So it's not dependent on a certain date on the calendar. If you move out of your planned service area, if you move into, let's say, into Insight, right, you would have special enrollment periods. There are certain things that, like, disasters happen. It's a FEMA declaration. COVID was an SCP. So yes, there might be a special enrollment period. They're just not things you can necessarily count on as a fixed time of year every year. So 2025. So this is the big stuff that you need to be aware of. A lot is changing with Medicare Part D specifically. Now, the deductible for Part D is going up. No surprise there. It always does. That is one number we do know for next year. Deductible being, of course, the cost you pay for drugs. Most drugs in the full amount up to the deductible is met before the plan starts to pay. So now that's $590 up from $545. The Part D coverage gap is eliminated. That used to be a stage of drug coverage where you would hit a certain retail threshold, retail cost of your drugs, and then you'd pay 25% coinsurance until you hit this massive out-of-pocket cost. That has been eliminated. So what will happen, and this is a very simplified version of the changes, not to overcomplicate things because it is a little bit nutty how they've set this all up, but $2,000 max out of pocket has been implemented. This is on specifically, it should say their Part D, prescription coverage. Whether you're on a standalone plan or Medicare Advantage, it's a $2,000 max out of pocket, which Medicare's never had. So there's never been a limit on out of pocket spending on Part D. There always has been on Medicare Advantage. And there's obviously a limit if you have a Medigap policy based on the policy you're on. So that's certainly a good thing in theory. Now, we don't know exactly how that's going to impact everyone because that has to be paid for in some way, shape, or form. And the responsibility is shifting more to the insurance companies and the pharmaceutical companies. So we'll see, what premiums look like next year and in years in the future, how the drug formularies look. Are the drugs going to be covered at the same cost? Are those going to be moved up to a different tier? So there are some things obviously that may negatively impact some people. There's not, can't win all around all the time, but hopefully that does help a number of people here. It certainly is nice to have some kind of limit on out-of-pocket spending. We've all had it typically on drug coverage until we reach Medicare. Another nice thing is if you are on those expensive drugs, okay, you have a brand name drug, let's say that requires you to, just say pay $1,000 the first time you fill it. Well, you can use the new Medicare prescription payment plan, which is basically a smoothing process where they will spread out your payments equally throughout the rest of the year. So you'll pay them monthly. So let's just take an easy number. If it's $1,100 and you go to fill it in January, you'll pay $100 a month from February through December. So you don't have to pay that all up front. And all those costs go towards your $2,000 max out of pocket. The insulin savings model has already been in effect. That's continuing. So insulin that's on the formulary will be capped at a $35 per month copay, which is a nice thing for those insulin-dependent diabetics. And in scope of appointment, this is a compliance thing, but just know if you're talking to a Medicare insurance agent, they should be asking for this before they can discuss plans, and it does need to be done at least 48 hours before an appointment. So that's a change that we certainly have to be aware of. But just understand if someone's asking you for that form to be signed, it's not an obligation to work with anybody. But there is some compliance things we have to make sure that we are following. It's a lot of rules here, so we want to make sure we're doing right by the client and obviously following the rules and that are in place for us. Now, future changes to look for. Okay, so next year, well, I'm sorry, 2026. We're not in 2025 yet, but just this week or last week, they released the negotiated drug prices for the list of 10 drugs there. This is also the first time that Medicare has been able to negotiate drug prices. So that will go into effect in 2026 for these 10 drugs. If you can't read them, they're Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enroll, Imbruvica, Stelara, and Fiasp Novolog. So I'm reading the other day, I'm still seeing that they're, despite the negotiations, the costs are still going to be higher for Medicare by, 2 to 5 times than they are in receiving these in other developed countries. But at least we are seeing some reduction in costs, and obviously the max out of pocket will help as well. So that is slated for 2026. And then next year, they'll release a list of 15 more drugs. And so that's set to go on for the next few years as they roll out these negotiated drug price to hopefully keep costs down for both for the beneficiary and for the Medicare program. So finally, how do we help? We can explain changes noted in the annual notice of change. So again, look out for that this month. It's not all super clear, so we can certainly help you to interpret kind of what's going on there with the ANOC or the annual notice of change. Of course, our services I mentioned earlier are no cost. So if you need a review of your coverage, it does not obligate you to make a change. I told you all earlier that's not typically needed, at least for more than half of people. So a review is certainly offered on your Advantage or Part D or even supplemental coverage, whatever you may have. Of course, if we are trying to help you out, we want to confirm that if you have a certain plan, your doctors remain in network, or if you're changing plans, the doctors remain in network. Present plan available plan options to you if you do need that assistance, and then ensure that at the end of the day, we want to make sure financial and medical decisions or needs are met. So this is a very important part of retirement. Obviously, it's not just your financial planning, but the medical part does go into it. So we always want to make sure we are meeting your needs and your goals with your coverage. So I'm going to stop. I'll stop here for questions, and yeah, we'll see what we can answer for you.
All right, so we have a couple questions. Please put any questions you guys have in here. First question from Stephanie. Part D coverage gap equals, is that the donut hole?
Yes, yeah. So it used to be called the donut hole. They say they closed that a couple years ago, just kind of changed how the co-insurance works. But yes, the coverage gap, also the donut hole.
Okay. And then her next question is, my dad has moved twice in the last 2 years. I think he didn't get some notices of plan change and premium bills, so he lost his Part D and was moved to some other plan over the summer. How can I check the address of record for Medicare and his supplement? He's a federal retiree.
So when it comes to Medicare, Medicare.gov, you could log in there. If you have his Medicare number, create an account, log in there. You can update that information. Also, his Social Security account. I would make sure all that stuff is aligned properly with his new address. In terms of federal retirees, now, again, federal program, we don't administer those benefits. That's really OPM. So you have to reach out to Office of Personnel Management if you need to update an address for any of those federal benefits.
Okay. And then Sue has a question. I'll be enrolling in Medicare for the first time in January for my end of April birthday. Do you help first-time enrollees like me to figure everything out?
Absolutely. That is what we do every day, really, is help first time enrollees. Of course, we help folks currently on Medicare, but 10,000 people a day, they say, are turning 65. So it's it's a fast growing and really massively underserved market, people that need help. So yes, so we do that all the time. So basically, if it's April, October is typically an appropriate time to get in touch, depending on what exactly you're going to do. A lot of the steps that you'll take and that we take with you would happen in January, February. But certainly can get in touch and start the process early, start asking questions, and absolutely help you get into Medicare A and B, shop your options, make sure you understand what decisions you have to make and feel comfortable in your coverage and get it all done early so you're not in on that in the middle of March, waiting for things to come in the mail.
Perfect, thank you. And then Diane would like to know, with regard to underwriting, we probably need to change from Medicare Advantage to Original Medicare. Does the underwriting just address the size of a premium, or might pre-existing conditions block us from coverage with a particular insurance company?
Great question. So both, right? So it can definitely block you. I mean, there are certain things that no company will write for. Now they're all a little different, so it's not universal, but certain things, no one's going to accept. There are other times where some companies will take you, others will not. Some may charge you a higher rate, some may not. So both can be true. Um, let me give you an exception to underwriting, for example. So if you have someone that went into, let's say they had a Medicare supplement their whole time on Medicare and then changed to a Medicare Advantage plan, and we're within the first 12 months, then you actually have what's called a Medicare Advantage trial right, which you can use a special enrollment period to go back to your supplement, your Medigap policy. Basically, would just enroll in a drug plan. It would kick out the Advantage plan. You'd get the supplement plan back with no underwriting. There are some other circumstances. So we talk about moving. So if you move out of your plan service area, you have a Medicare Advantage plan. Now, this is, again, not universal. A lot of these things, it can depend on the state. And some states are a little bit more generous, by the way. So these rules about underwriting are not 100% across the board, but in the majority of cases. But moving out of the planned service territory may also open up a guaranteed issue situation for a Medigap policy. So it's always worth looking at, right? Don't feel like defeated that it's never going to happen. It just depends on the situation.
Perfect. I know a couple things we've had pop up before, Kevin, we've talked to families about, is some people are on insurances that are more on preventative care versus treating people who already have diagnoses. And they can be very difficult to work with once you have a diagnosis of dementia and if you have to move into a memory care. And so we do encourage people to look at a different plan in those cases, just to make it easier when it comes to managing care and making sure they get the right care that they need. I don't know how often you work with people on that scenario.
Yeah, I mean, I would say less frequent than um, the people that are new to Medicare, right? It's just because the whole thing's overwhelming. It's new, right? We're not trained or educated on how to shop for insurance, really. It's kind of like, oh, you have an employer plan and that's what you get.
Yeah.
Or you go onto the marketplace if you have an individual policy and good luck and just pick something and go there. So that's what we deal with more often, but we're familiar with those situations as well. Just everything's case by case, so it's always like you just reach out and let's understand the situation better. How can we help if we can, or at least point you in the right direction if it's not something that we can really assist with.
Yeah. Another question from Stephanie. You mentioned a special enrollment could be moving to a care facility. Would this also include moving from assisted living to skilled nursing? If it is a different address, yes, unless Kevin has something else to say on that.
Okay.
And does memory care qualify for Medicare payment?
So let me go the one first question about special enrollment period. So that should be yes. Now understand that a special enrollment period would be more like you can change your let's say Medicare Advantage to Advantage or Part D to Part D or vice versa. Unless it's in a new area, like out of the service territory, if you just move within this county, let's say, that's not a special enrollment for Medigap, especially, right? So that doesn't always guarantee a Medigap guaranteed issue. The other, I'm sorry, I
The other
forgot.
question was, memory care, does that qualify for Medicare payment?
Are we talking like the cost to stay?
I'm assuming that's what she means, and that's, memory care is under assisted living.
Yeah, so Medicare is not going to cover any of that stuff, unfortunately.
Yeah, it doesn't pay room and board. It will cover all the medical needs that may come up while they're
Right.
living there. But unfortunately, memory care is not, skilled nursing is different, and you have an allotted amount of time on Medicare. You can use skilled nursing fees, but memory care does not fall under that. So Ray has a question. Can you explain FEP offer for retirees to switch to a Medicare Part D drug plan from BC/BS drug plan, pros and cons of opting out?
So I really can't speak to FEP. It's just, we don't, that's a government employee benefit, retiree benefit. And so we don't work intimately with those plans because we just can't help with them, right? So we certainly try to help folks when they reach out about Medicare if they have FEP, but it's really just a conversation about, what do you need to know? Not, there's no other insurance to look at. Now I know that FEP, and I don't know enough about it, but I guess is now saying to go get your own drug plan. I would have to do a little more digging because that's, I think, a pretty new thing.
Mhm.
And again, just historically, we don't work with FEP because, or I'm sorry, federal retirees because they have FEP.
Okay, and then the second part of the question, because it was going to be a lot of letters and words. And can you go back to Blue Cross Blue Shield without penalty then, or return to Part D plan in the future?
Sure. And I'm just going to move this here just in case these are, if you ever have a question that's maybe not answered afterward, you want to reach out about this. But so my understanding with FEP, so you could, let's say you're on A and B and FEP, just full on federal benefit, and you suspend it and go on a Medicare Advantage plan. In that case, FEHB or FEP is suspended and you can go back to it. If you were to say, I'm opting out and going on to original Medicare with a Medigap policy and a Part D plan, then you would be basically giving it up. Now, again, I don't know enough about FEP's specific Part D benefit, but generally, you can either suspend it for Advantage or you abandon it if you leave it entirely and don't replace it with an Advantage plan, excuse me.
Perfect. I don't see any other questions. If anybody has anything else, please feel free. We had quite a few thank yous and some people will be in touch with you. So if there's not anything else, like you said, his contact information is on the screen and you guys can reach out to him for that. We will have this online as well, probably by next week sometime to share with you. And then I'm going to just close out with a couple things really quickly here. I'm gonna pop over to my screen just real quick here. Oh, it did not go where I wanted to, sorry. Okay, so upcoming events, we'll let you put yours back up in case they need it, and we'll have it in the, we're gonna share the PowerPoint, so they'll get it from there as well. If you'd like any other events coming up with Insight, please go to insightmcc.org/events. If you have any questions for me about this or other programs, please feel free to reach out. My email and phone number are there. And we have lots of great events coming up. If you're local, we're doing the Still Alice documentary out at the Lorton Art Museum at the old jail in 2 Saturdays. We'll be out there at 4 o'clock showing that, and they're doing food trucks and the galleries are open and all kinds of fun stuff. So, lots of different things like that, but feel free to look on our calendar for anything and us getting this presentation up. But Kevin, thank you again for being here for us. And we really appreciate you, and we'll look for you next year.
My pleasure, Melissa. Thanks for having me. Thank you, everybody, for attending, for your questions. And yeah, just feel free to reach out if there's anything you feel we can help you with.
Great. Thank you. Everyone have a great night.
Thanks, you too.